Today, let's learn something about Chapter 14, Injury and Illness. Humankind has always sought ways to treat illness, injury, and pain. For example, the first known brain surgeries occurred about 6,000 years ago in Asia Minor. Also, archaeologists have found skulls of ancient Incas of Peru with small pieces of skull carefully removed to treat head wounds or possibly to cure illness or infections. The earliest of these Incan skulls did not show any healing, indicating that the patient soon died. But by the 1400 years, about 90% of the ancient skulls discovered showed bone regrowth. How did those patients survive and how did they deal with the pain? It is likely that herbs like tobacco and coca leaves and corn beer might have been consumed to provide some relief. As you learn about brain tumors, head trauma, pain management, and other problems caused by disease processes, remember that neuroscience seeks to understand the roots of these issues. Such insights will ultimately advance the medical field, enabling more effective treatment and therapies for the future. And the first section we're going to learn is brain tumors. Each year, more than 79,000 people in the United States are likely to be diagnosed with a tumor that originates in their brain, a primary brain tumor. An estimated 26,000 of these tumors will be malignant, and 53,000 will be benign. In addition, more than 2 million people will be diagnosed with brain tumors that develop when cancer cells from other parts of the body travel through the bloodstream to the brain, called metastatic brain tumors. These cancers typically spread from tumors of the lung, breast, skin, colon, or kidney. Regardless of its origin, a tumor or any space-occupying lesion in the brain can be lethal. Thus, surgical removal is required for survival. Types of brain tumors are named according to the kind of cell from which they arise and the brain area where they develop. For example, many brain tumors are called gliomas, a general term for tumors that arise from the glia cells that support and protect neurons in the brain. The most common form of brain cancer is glioblastoma, a proliferation of immature glial cells. The most common type of primary brain tumor is meningioma, a benign tumor arising in the meninges, the thin layers of tissue that cover the brain. Symptoms of the brain tumor vary with its location and size, and also differ among people. In some cases, a tumor causes general symptoms, such as headache, due mainly to the pressure a tumor exerts on the brain. Or, a tumor located in a part of the brain controlling vision can cause difficulties with sight. In other cases, a tumor can damage healthy tissue as it grows. For example, a gliomas grow, they release toxic amounts of glutamate, which can destroy nerve cells near the tumor and cause seizures. And in this picture, it shows 10 signs of brain cancer. And also several treatments, including surgery, radiation, targeted treatment, and Chemotherapy can be used alone or in combination to treat brain tumors. The goal of the treatment is to remove or shrink brain tumors to relieve pressure on the brain, as well as eliminating or reducing symptoms such as seizures and headaches. Blocking tumor blood vessel formation is a key strategy in treating glioblastomas because these tumors form strong networks of vessels that feed tumor growth. And the second part we're going to learn is about traumatic brain injury. Widespread use of CT and MRI techniques has afforded opportunities to observe the extent of tissue damage in TBI and determine its medical management. Traumatic brain injuries are caused by bumps, blows, or jolts to the head that cause multiple minuscule bleeds, or by penetrating head injuries that directly destroy brain tissue. TBI can be mild, such as concussion, a temporary disruption in brain activity, or severe TBI can cause bruises in the brain, massive bleeding inside the brain, cuts in the brain tissue, direct nerve damage and death of nerve cells. Brain injury can trigger swelling, fever, seizures, and other neurological impairments. Even mild TBI can cause damage to neurons, which release pro-inflammatory factors that initiate and sustain an inflammatory response. People such as professional football players or boxers who sustain repeated concussions and other brain trauma may develop a progressive degenerative brain diseases called CTE. CTE occurs when repeated head trauma triggers degeneration of brain tissue. This process includes a buildup of abnormal proteins, which can be which can begin months, years, or even decades after the last brain trauma. Symptoms associated with CTE include memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, and eventually progressive dementia. And most people with mild brain injuries, such as concussion, recover fully in a short period of time. Yet a study of college ice hockey players who had concussions showed that their brain volume had decreased 2 weeks after the concussion, a change that lasted at least 2 months. Rest and avoidance of physically demanding activities give the brain time to heal and are key aspects of recovery. People who arrive in the emergency department with a severe head injury are carefully monitored for bleeding or swelling that puts pressure on the brain. Treatments for increased pressure inside the skull include removing an amount of water fluid from injured and inflamed brain tissue. Once a person with a brain injury is stable, the long road to recovery begins. Physical and occupational therapy are used to help people regain lost functions such as speech and movement. A wide variety of medications can be used to treat other symptoms of TBI, such as pain, seizures, muscle spasms, sleep disorders, depression, and anxiety. And the next part is spinal cord injury. Like TBI, spinal cord injuries are called SCI, can permanently damage nerve cells and cause a wide range of disabilities, including various degrees of paralysis. Methylprednisolone, a steroid drug, is the only treatment for SCI currently approved by the US FDA. This medication appears to reduce damage to nerve cells and decrease inflammation near the site of the SCI. If administered within 8 hours of injury, it can be effective in treating spinal cord injuries in some people. And the next part is called acquired immune deficiency syndrome. The human immune immunodeficiency virus, also called HIV, the virus that causes acquired immune deficiency syndromes, is called AIDS. Currently, an estimated 37 million people worldwide live with HIV. The vast majority live in Eastern and Southern Africa, and about 40% of people living with HIV are unaware that they are infected with the virus. From 2010 to 2014, the estimated number of new HIV diagnoses in the US fell by 80%, possibly due to targeted prevention efforts. Although HIV targets the immune system, the nerve system can also be affected. More than half of people with HIV develop HIV-associated neurocognitive disorders, called HAND. HAND causes mental problems ranging from mild difficulty with concentration, memory coordination, and complex decision-making to progressive dementia called AIDS dementia. Even people who receive treatment can develop mild symptoms of HAND. The mechanism behind the development of HAND is unclear. Most scientists speculate that certain proteins in the virus itself, or proteins released by cells infected with HIV, cause nerve damage leading to the disorder. Whatever the mechanism, HIV infection appears to be the key players in HAND because the treatment may prevent or reverse it in many people. Mild forms of HAND have been reported in about one-third of people with HIV infection who have no other symptoms. In advanced diseases, people can develop increasing problems with concentration and memory as well as an overall swelling of their mental processes. At the same time, they may experience leg weakness and loss of balance. Another neurological problem commonly developed by people with HIV is peripheral neuropathy. Peripheral neuropathy involves injury to the nerves of the extremities and causes discomfort ranging from tickling and burning to severe pain. HIV is believed to target the injury, and certain ARVs can cause the neuropathy or make them more frequent and serious. More than half of people with advanced AIDS have neuropathy. Despite remarkable advances in the new therapies, AIDS cannot be cured. and some of its neurological problems do not respond to treatment. In addition, people living with HIV are particularly vulnerable to certain infections and cancers because the virus weakens their immune system. Fortunately, combination ARVs have greatly reduced the incidence of most of these infections, as well as some of the neurological problems associated with AIDS. And the next part is about multiple sclerosis. Multiple sclerosis, also called MS, is an inflammatory disease of the central nervous system, usually diagnosed in people between 20 and 40 years of age. For unknown reasons, the immune system of a person with MS launches an attack against its own central nervous system, including the brain, spinal cord, and optic nerves. The target of this attack is the myelin sheath, a fatty substance that forms a protective coating around nerve fibers. The nerve fibers themselves can also be affected. As a result of the attack, the damaged myelin and the accompanying inflammatory cells form lesions, patches of scar tissue that look like sclerosis. In MS, the, the patches of disease activity appear in multiple areas of the central nervous system, which is why the disease is called multiple sclerosis. Damage to myelin sheaths and the nerve fibers interferes with transmission of nerve impulses within the brain and spinal cord, as well as their communication with other body areas. The effects of MS are often compared to the loss of insulation around an electric wire and damage to the wire itself, interfering with signal transmission. Damage can occur in the white and gray matter of the brain. The cause of MS is unknown, but there are some hints that a genetic factor is involved. Damage to the nerve system in people with MS can cause a wide array of symptoms. The spinal cord, cerebellum, and optic nerve are commonly affected by MS, so problems often arise in functions controlled by those areas. Symptoms include numbness and blurred vision. Other symptoms are slurred speech, weakness, pain, loss of coordination, uncontrollable tremors, loss of bladder control, memory loss, depression, and fatigue. MS has no cure, but an increasing number of medications are becoming available or are under investigation since 2010. Six new or revised disease-modifying therapies have been approved for use in people with MS. In addition, several medications can now help control the inflammation and immune system attacks in relapsing remitting MS. Steroid drugs, specifically glucocorticoid, glucocorticoid reduce inflammation and may also help shorten acute attacks. Medications and therapies are also available to control symptoms such as muscle stiffness, pain, fatigue, mood swings, and bladder, bowel, or sexual dysfunction. And the last part is about stroke. Stroke is an interruption in blood flow to the brain due to a ruptured blood vessel or blood clot. And risk factors of stroke include obesity, physical inactivity, or heart diseases. Controlling these factors by maintaining a healthy full weight, exercising, avoiding excessive alcohol intake, and taking medications for stroke-related physical problems such as high blood pressure can reduce the risk of having a stroke. There is also a genetic component in stroke risk, especially evident if a parent has suffered a stroke by age 65. To date, several candidate genes have been suggested, but increased stroke risk is most likely due to multiple genetic factors. Until recently, treatments for a stroke did not go far beyond physical or speech therapy. Today, however, clot-dissolving medications are a standard treatment, and TPA, a clot-dissolving drug approved by the FDA in 1996, helps to break down blood clots and open blocked blood vessels. TPA can restore circulation before oxygen loss causes permanent brain damage. Given within 3 hours of a stroke, its use often limits brain damage. In addition, surgery to clear clouded arteries and other treatments targeting heart disease can help prevent strokes. Anticoagulant drugs also help by reducing the likelihood of clots forming elsewhere in the body and traveling to the brain, causing a stroke. And that's all about chapter 14.